Hello, in this video we're going to go over the treatment and vitals panel here, and again we're using a PCR that we created in earlier videos. So if you look at the top of these fields, it starts with the base hospital contact date. It is not red, and this is one of those fields that we're not going to make it mandatory, but if it makes sense that it needs to be filled out, you should definitely go and fill that out. So for this one we're just going to say that we contacted the hospital, we'll say 5 minutes before arrival, and we'll say it was Goleta Valley Hospital. And then barriers to patient care. Most of these are going to be none, but just go ahead and look through these now. Just be familiar with what is in this list, and if you ever have one of these cases impact your access to the patient, go ahead and note that there. Now in the previous videos we imported LifePak 15 data. You see this is all the fields that were imported, and they're all red because although it does import the information from the LifePak, it doesn't import enough information. There's always going to be a little bit something you need to do. And one of the things we did on ImageTrend Elite is we created a rule where it's going to look for multiple sets of vital signs, but once you have those done, it's going to validate that you're good to go for the call. So as an example, for blood pressure, it's going to require 2 full sets of blood pressures, and as you can see, when it imports data from the LifePak 15, it imports quite a few, and it's kind of a pain if it just blankly said that we want a blood pressure, pulse, and respiration on every set of vital signs. That's not practical for the imports, so it's going to look for 2 sets of blood pressures. So as you look here, this import had a blood pressure and pulse. This one it just had a pulse. This one had nothing. So to show you how this works, we'll just open this up, and you'll look through. This is going to be for all blood pressures. It doesn't know, it should, but it doesn't know it's coming from an automated blood pressure cuff. So we'll select that. Pulse oximetry, I think we're going to make some modifications to this because obviously we're not necessarily going to get a pulse ox on every patient, and there's not really a none field that's going to satisfy the validation rules here. So we'll go ahead and fill that in. Again, any qualifiers if they're on O2 or room air, respiratory rate. Blood glucose level, that's the same. Obviously we're not going to do 15 glucose levels. Once those are filled in, you'll say OK, and you'll see that this one is now good to go. And if we do another blood pressure here, automated cuff, we'll fill these in. It's something here. So all the blood pressures that it takes are going to require, you see all these other ones are no longer mandatory because it's looking for 2. Once you've got 2 of those entered in there, you're not going to have to keep doing them. But for the blood pressures, it's never going to know what kind of cuff it was. So once you get that filled out, you're good to go on that one. Another one here. Automated cuff, you're good to go, and that's it. So it's pretty simple, a lot easier than the current version of ImageTrend. So those are all your vital signs that you imported from the LifePak 15. And then obviously if you wanted to add additional ones that were done manually, you can just click on the add button here and it'll take you to that same field where you can fill it out. Procedures are the same. These are all the ones that were imported from the LifePak 15. If you click on here, it'll let you know what is missing. Was it done prior to the EMS unit arriving on scene? We'll say no. This is just pulling in the default, so it's defaulting to the primary patient caregiver. So if for whatever reason it wasn't this person, you can manually change it. The procedure is automatically defaulted to what the LifePak 15 said it was. In this case, it was a 12-lead EKG. Was it successful? Yes, obviously, because we have it. And number of temps. Now these are just NEMSIS required fields, so although Doesn't make a whole lot of sense, especially like a 12 lead, successful or not, and number of procedures. You're still going to have to fill those in. Same with authorization. This one will just do a protocol standing orders. Say OK, and then you just have to go through each one of these here and fill them out the same way. And it's a defibrillation. It's interesting. Well, at least this is right. I don't know how you can unsuccessfully defibrillate somebody. Complications doesn't make a whole lot of sense here, unless you know someone who got diarrhea from being defibrillated. This one is pertinent here, whether or not, I guess if they had ROSC, you could say that the patient was improved. So those are filled out. You see the red boxes are all gone, and you're good to go. Now, these medical devices, these are the actual images that are brought in. There's not anything you need to do with these. It'll have the waveform here. If you click on that, it's going to give you a little image. It's not very easy to see because it's so small, but it gives you a little image of what was imported by the LifePak 15. We'll cancel out of here and look at another one of these. Now we'll be doing some more work on these. Obviously, if you did a defibrillation, there are some things here. Total number of shocks, the rate of pacing. Ideally, these are going to be imported by the LifePak 15, and we've been told that that is going to happen in the future, but for now it's not. So just again, this goes into not just looking for the red fields, but documenting your PCR to reflect the treatment and care that you gave to the patient. So if you pace somebody, you want to make sure that even though these are not red, that you go in and you enter in what the pacing rate was, whether or not it was captured. All right, so that's it for the treatment and vitals. If you need to add additional medications, again, these will at some point be imported by the LifePak 15, like we're currently doing. Right now, they don't have the key indicators set up there. But you want to enter the time it was administered. This has the same grid here, so you can say that we gave this 5 minutes after we arrived on scene. Who gave it? And the medication that was administered. Now this list is limited to what we carry. The route, at some point we're going to try and get these to default to the route that makes sense for that medication. It's not possible to do it right now, but we're hoping that that will be done. Will be done here shortly. So we'll put the dose in here, milligrams, and again you got your complications here. Oh, missing something. All right, so on something like this where you don't have any red fields in here, but shows something is missing, you can go to the validation section here. Then this is an error on our side. Something isn't configured right. So if you run into these, you can click on the validation here, and it's going to show all the validation errors, and just go through and try and figure out what. This is probably it right here. Yeah, so if you find these, and I'm sure we will, let us know, shoot us an email, and we're going to have to go through and modify that form and push it out. So I'm glad I found this. We'll make a note of it. Clearly, you can't validate this field because the field does not exist, right? So we'll go ahead and get that fixed. And we'll delete that just so it doesn't cause us problems later. So that's it for the treatment and vitals. Actually, we'll go in here to procedures. And actually, let's make that. We'll do again 5 minutes after we got on scene. No. I just wanted to show you that if we do, some of these fields will control validations and visibility rules. And if we do an oral tracheal intubation, we'll say yes. So when you click on that, that is going to open up additional fields. So this wasn't visible until you added a procedure for a innovation. So don't be surprised as you add things and you think you got all your red boxes filled out. You'll add something and then you've got 3 or 4 more you didn't need to fill out. So for the airway, the advanced airway, they require you to add the indication for the airway. And then there's an advanced airway confirmation section that you need to complete. Again, actually on this one we're doing that 5 minutes after on scene time in the tracheal, and then this is a multiple select. And then just fill this out to the best of your knowledge. Tube depth, we'll say it was 22 at the teeth. Breath sounds, not sure why that's defaulting to no. Just be careful when you fill these out to make sure it all makes sense and reflects the care that you gave. Chest rise, yes. And that's it. And we're still missing something. We may have found another one here. Alright, so again, let's go to the validation screen. And this is it here, unable to navigate. Oh, so that field's not there either. So verification of the tube placement is required when ETT is documented. Well, that's interesting because I thought that's what we just did. Alright, well that's one more thing we're going to have to take a look at. Alright, and again, with the exception of the errors that we're going to have to fix on the back end, we're done with that, and thank you for watching.